Medical Destiny uploads educational and informational videos related to health and medical topics. If you would like to get such kinds of videos, kindly subscribe our channel.
NCLEX-RN exam questions with answers. (501). Number in order the actions that the nurse takes to perform hand washing procedure. Number 1 is the first action and number 6 is the last action. 1. Dash. Dry the hands. 2. Dash. Turn off the water faucet. 3. Dash. Rinse the hands and wrists. 4. Dash. Wash all surfaces for 15 to 30 seconds. 5. Dash. Obtain 3 to 5 milliliters of soap from the dispenser. 6. Dash. Wet the hands and wrists, keeping the hands lower than the elbows. Answer: 5, 6, 4, 3, 2, 1. Rationale: proper hand washing procedure involves wetting the hands and wrists and keeping the hands lower than the forearms so water flows toward the fingertips. The nurse uses 3 to 5 milliliters of soap and washes all surfaces for 15 to 30 seconds using a rubbing and circular motion. The hands are rinsed and then dried, moving from the fingers to the forearms. The paper towel is then discarded, and a second one is used to turn off the faucet to avoid hand contamination. 502. A client who is immunosuppressed is being admitted to the hospital on neutropenic precautions. Nursing interventions to protect the client from infection include which measures? Select all that apply. 1. Restrict all visitors. 2. Admit the client to a semi-private room. 3. Place a mask on the client if the client leaves the room. 4. Use strict aseptic technique for all invasive procedures. 5. Place a "See the nurse before entering" sign on the door to the room. 6. Remove a vase with fresh flowers in the room that was left by a previous client. Answer: 3, 4, 5, 6. Rationale: the client who is on neutropenic precautions is immunosuppressed and therefore is admitted to a single room on the nursing unit. A sign indicating "See the nurse before entering" should be placed on the door to the client's room so the nurse can ensure that neutropenic precautions are implemented by anyone entering the room. Sources of standing water and fresh flowers should be removed to decrease the microorganism count. The client should wear a mask for protection from exposure to microorganisms whenever he or she leaves the room. Not all visitors must be restricted. However, visitors need to be restricted to healthy adults and must perform strict hand washing procedures and don a mask before entering the client's room. The use of strict aseptic technique is necessary with all invasive procedures to prevent infection. 503. A home care nurse is providing instructions to the mother of a toddler regarding safety measures in the home to prevent an accidental burn injury. Which statement by the mother indicates a need for further instruction? 1. I need to use the back burners for cooking. 2. I need to remain in the kitchen when I prepare meals. 3. I need to be sure to place my cup of coffee on the counter. 4. I need to turn pot handles inward and to the middle of the stove. Answer: 3. Rationale: toddlers, with their increased mobility and developing motor skills, can reach hot water or hot objects placed on counters and open fires or burners on stoves above their eye level. Parents should be encouraged to remain in the kitchen when preparing a meal, use the back burners on the stove, and turn pot handles inward and toward the middle of the stove. Hot liquids should never be left unattended, and the toddler should always be supervised. The mother's statement in option 3 does not indicate an adequate understanding of the principles of safety. 504. The nurse prepares a client who has a right pleural effusion for a thoracentesis. However, the client experiences severe dizziness when sitting upright. Into which alternate position does the nurse assist the client to maintain safety during the procedure? 1. Right side lying with the head of the bed flat. 2. Prone with the head turned toward the affected side. 3. Sims position with the head of the bed elevated 45 degrees. 4. Left side lying with the head of the bed elevated 45 degrees. Answer: 4. Rationale: a thoracentesis is a procedure in which fluid or air is removed from the pleural space via a transthoracic aspiration. Positioning can help isolate the fluid in a pleural effusion. Generally, the client sits at the edge of the bed, leaning over the bedside table, allowing the fluid to collect in a dependent body area. If the client is unable to sit up, the nurse turns the client to the unaffected side and elevates the head of the bed 30 to 45 degrees. Turning to the affected side, the prone and the Sims positions are unsuitable positions for this procedure because these do not facilitate fluid removal. 505. A physician has written a prescription to administer methogyny to a postpartum client with uterine atony. The nurse would contact the physician to verify the prescription if which of the following conditions were present in the mother? 1. Hypertension. 2. Excessive lochia. 3. Difficulty locating the uterine fundus. 4. Excessive bleeding and saturation of more than 1 rupad per hour. Answer: 1. Rationale: methogyne is an ergot alkaloid. It is contraindicated for the hypertensive woman, individuals with severe hepatic or renal disease, and during the third stage of labor. Excessive lochia, a uterine fundus that is difficult to locate, and excessive bleeding are clinical manifestations of uterine atony indicating the need for methylagenovine. 506. After receiving detailed information about a colonoscopy from the provider, the nurse asks the client to sign the informed consent form and discovers that the client cannot write. Which is the best intervention for the nurse to implement? 1. Contact the provider to obtain informed consent. 2. Obtain a verbal informed consent from the client. 3. Have two nurses witness the client sign with an X. 4. Clarify information to the client with another nurse. Answer: 3. Rationale: nurses are responsible to make sure that the signed informed consent form is in the client's medical record before a procedure and for clarifying facts that have already been presented by the provider. Nonetheless, the person performing the procedure obtains informed consent and provides the explanations to the client. Informed consent can be obtained verbally, but that is also the responsibility of the provider. Clients who cannot write may sign an informed consent with an X in the presence of two witnesses. Nurses can serve as a witness to the client's signature but not to the fact that the client is informed. 507. A child with a brain tumor is admitted to the hospital for removal of the tumor. To ensure a safe environment for the child, the nurse includes which of the following in the plan of care? 1. Initiating seizure precautions. 2. Using a wheelchair for out-of-bed activities. 3. Assisting the child with ambulation at all times. 4. Avoiding contact with other children on the nursing unit. Answer: 1. Rationale: seizure precautions should be implemented for any child with a brain tumor, both preoperatively and postoperatively. Options 2 and 3 are not required unless functional deficits exist. Based on the child's diagnosis, option 4 is not necessary. 508. The nurse caring for a chronically ill client whose condition presents a poor prognosis shows an understanding of the basic values that guide the implementation of a living will when asking, select all that apply. 1. Are you planning to become an organ donor? 2. Do you feel the need to discuss your end-of-life decisions with your family? 3. Did you have the discussion with your son about being your healthcare surrogate? 4. Can we discuss what will happen if you decide to refuse antibiotics if you get an infection? 5. Have you given thought to whether you want cardiopulmonary resuscitation measures if your condition worsens? Answer: 2, 4, 5. Rationale: a living will lists the treatment that a client chooses to omit or refuse if the client becomes unable to make decisions and is terminally ill. Although both the living will and durable powers of attorney for healthcare are based on values of informed consent, autonomy over end-of-life decisions, and control over the dying process, living wills do not involve healthcare surrogates or the decision to donate organs. 509. A nurse is reviewing the results of the rubella screening with a pregnant 24-year-old client. The test results are positive, and the client asks if it is safe for her toddler to receive the vaccine. The appropriate nursing response is: 1. Most children do not receive the vaccine until they are 5 years of age. 2. You are still susceptible to rubella, so your toddler should receive the vaccine. 3. It is not advised for children of pregnant women to be vaccinated during their mother's pregnancy. 4. Your titer supports your immunity to rubella, and it is safe for your toddler to receive the vaccine at this time. Answer: 4. Rationale: all pregnant women should be screened for prior rubella exposure. A positive maternal titer indicates that a significant antibody titer has developed in response to a prior exposure to the rubevirus. All children of pregnant women should receive their immunizations according to schedule. Additionally, no definitive evidence suggests that the rubella vaccine virus is transmitted from person to person. 510. After delivery, the postpartum nurse instructs the client with known cardiac disease to call for the nurse when she needs to get out of bed or when she plans to care for her newborn infant. The nurse informs the client that this is necessary to: 1. Help the mother assume the parenting role. 2. Minimize the potential of postpartum hemorrhage. 3. Provide an opportunity for the nurse to teach newborn infant care techniques. 4. Avoid maternal or infant injury caused by the potential for syncope or overexertion. Answer: 4. Rationale: the immediate postpartum period is associated with increased risks for the cardiac client. Hormonal changes and fluid shifts from extravascular tissues to the circulatory system cause additional stress on cardiac functioning. Although options 1, 2, and 3 are appropriate nursing concerns during the postpartum period, the primary concern for the cardiac client is to maintain a safe environment because of the potential for cardiac compromise. 511. The nurse is assessing a client who has just been measured and fitted for crutches. The nurse determines that the client's crutches are fitted correctly if: 1. The top of the crutch is even with the axilla. 2. The elbow is straight when the hand is on the hand grip. 3. The client's axilla is resting on the crutch pad during ambulation. 4. The elbow is at a 30-degree angle when the hand is on the hand grip. Answer: 4. Rationale: when using crutches, for optimal upper extremity leverage, the elbow should be at approximately 30 degrees of flexion when the hand is resting on the hand grip. The top of the crutch needs to be 2 to 3 finger widths lower than the axilla. When crutch walking, all weight needs to be on the hands to prevent nerve palsy from pressure on the axilla. Therefore, options 1, 2, and 3 are incorrect. 512. When assessing the client with a wrist restraint at the beginning of day shift, which observation by the charge nurse would indicate that the nurse who placed the restraint on the client failed to follow safety guidelines? 1. A safety knot was used to secure the restraint. 2. The call light was placed within reach of the client. 3. The restraint was applied tightly around the client's wrist. 4. The client's record indicates that the restraint was released every 2 hours. Answer 3. Rationale: a restraint should never be applied tightly because it could impair circulation. A safety knot may be used on the client because it can easily be released in an emergency. The call light must always be within the client's reach in case the client needs assistance. The restraint needs to be released every 2 hours to provide movement. 513. The nurse documents a written entry regarding client care in the client's medical record. When checking the entry, the nurse notices that she documented some incorrect information. Which should the nurse implement? 1. Obliterate the incorrect information with a black marker. 2. Use correction fluid to cover up the incorrect information. 3. Erase the error completely and write in the correct information. 4. Draw a line through the incorrect information and initial the change. Answer 4. Rationale: to correct a written error documented in a medical record, the nurse draws one line through the incorrect information and then initials the error. The information remains visible and properly labeled as incorrect. Errors are never erased, and correction fluid or black markers are never used on legal documents such as the medical record. 514. A client receiving chemotherapy has an extremely low white blood cell count and is immediately placed on neutropenic precautions that include a low bacteria diet. Which food items is the client allowed to consume? Select all that apply. 1. Raw celery. 2. Fresh apple. 3. Italian bread. 4. Tossed salad. 5. Baked chicken. 6. Well-cooked cheeseburger. Answer 3, 5, 6. Rationale: an extremely low white blood cell count places the client at risk for infection. In the immunocompromised client, a low bacteria diet is implemented. This diet includes avoiding fresh fruits and vegetables and ensuring that meat is thoroughly cooked. Fresh fruits and vegetables harbor organisms and place the client at risk for infection. Italian bread, baked chicken, and a well-done cheeseburger are acceptable to consume. 515. A nurse has cared for a client on isolation that required the use of gloves, a mask, goggles, and a gown. Number in order of priority how the nurse removes the protective items on leaving the client's room. Number 1 is the first action and number 6 is the last action. 1. Removes goggles. 2. Removes the mask. 3. Removes the gloves. 4. Allows the gown to fall from the shoulders. 5. Unties the neck strings and the back strings of the gown. 6. Holds the gown inside at the shoulder seams, folds it inside out, and discards it in the appropriate trash receptacle or laundry bag. Answer 6, 2, 1, 4, 3, 5. Rationale: the nurse should remove gloves first because these are the items that are most contaminated. The nurse then carefully removes the mask by touching only the elastic or mask strings. Ungloved hands will not become contaminated by touching only the elastic or mask strings. Then the nurse unties the neck strings and the back strings of the gown and allows the gown to fall from the shoulders. The nurse removes the hands from the sleeves, without touching the outside of the gown, holds the gown inside at the shoulder seams, folds it inside out, and discards it in the appropriate trash receptacle or laundry bag. The nurse removes the goggles and then washes the hands. 516. The nurse observes that a post-operative client has episodes of extreme agitation. Which is the best nursing measure to implement to help avoid episodes of agitation? 1. Gently hold the client's hand while speaking. 2. Wait until the client's agitation has subsided. 3. Speak while moving slowly toward the client. 4. Speak to the client from the entrance to the room. Answer. 3. Rationale: speaking and moving slowly toward the client will prevent the client from becoming further agitated, because any sudden moves or speaking too quickly may cause the client to have a violent episode. Holding the client's hand can be misinterpreted by a client to mean restraint. If the client's agitation is not addressed, it is likely to increase, therefore waiting for the agitation to subside is not a suitable option. Remaining at the entrance of the room can make the client feel alienated. 517. A 17-year-old client is about to be discharged to home with her newborn baby, and the nurse provides information to the client about home safety for children. Which statement by the client would alert the nurse that further teaching is required regarding home safety? 1. I keep all my pots and pans in my lower cabinets. 2. I will not use the microwave oven to heat my baby's formula. 3. I have locks on all my cabinets that contain my cleaning supplies. 4. I have a car seat that I will put in the front seat to keep my baby safe. Answer. 4. Rationale: a baby car seat should never be placed in the front seat because of the potential for life-threatening injury on impact. It is perfectly safe to leave pots and pans in the lower cabinets for a child to investigate, as long as they are not made of glass, which would harm the baby if broken. Microwave ovens should never be used to heat formula because the formula heats unevenly, and it could burn and even scald the baby's mouth. Even though the bottle may feel warm, it could contain hot spots that could severely damage the baby's mouth. Any cabinets that contain dangerous items that a baby or child could swallow should be locked. 518. A nurse has administered an injection to a client. After the injection, the nurse accidentally drops the syringe on the floor. Which nursing action is appropriate in this situation? 1. Obtain a dustpan and mop to sweep up the syringe. 2. Call the housekeeping department to pick up the syringe. 3. Carefully pick up the syringe from the floor and gently re-keep the needle. 4. Carefully pick up the syringe from the floor and dispose of it in a sharps container. Answer. 4. Rationale: syringes should never be recapped, in any circumstances, because of the risk of getting pricked with a contaminated needle. Used syringes should always be placed in a sharps container immediately after use to avoid individuals from becoming injured. A syringe should not be swept up, because this action poses an additional risk for getting pricked. It is not the responsibility of the housekeeping department to pick up the syringe. 519. The nurse is assigned to care for a client who is in traction. The nurse ensures a safe environment for the client by 1. Making sure that the knots are at the pulleys. 2. Checking the weights to be sure that they are off the floor. 3. Making sure that the head of the bed is kept at a 90-degree angle. 4. Monitoring the weights to be sure that they are resting on a firm surface. Answer. 2. Rationale: to achieve proper traction, weights need to be free-hanging, with knots kept away from the pulleys. Weights are not to be kept resting on a firm surface. The head of the bed is usually kept low to provide counter-traction. 520. A nurse is observing a client using a walker. The nurse determines that the client is using the walker correctly if the client 1. Puts weight on the hand pieces, moves the walker forward, and then walks into it. 2. Puts weight on the hand pieces, slides the walker forward, and then walks into it. 3. Puts all 4 points of the walker flat on the floor, puts weight on the hand pieces, and then walks into it. 4. Walks into the walker, puts weight on the hand pieces, and then puts all 4 points of the walker flat on the floor. Answer. 3. Rationale. When the client uses a walker, the nurse stands adjacent to the affected side. The client is instructed to put all 4 points of the walker 2 feet forward flat on the floor before putting weight on the hand pieces. This will ensure client safety and prevent stress cracks in the walker. The client is then instructed to move the walker forward and walk into it. Therefore, options 1, 2, and 4 are incorrect procedures for using a walker.
Thanks for watching. If you like this video and you would like to watch similar videos in future, please subscribe our channel and tap the bell icon.